A lot of people are walking around with a skin tag or a mole. They would see their primary care doctor who has 8 minutes to take care of them, and that primary care doctor will say, please go see dermatology. They wait 2 months, spend $350 for the visit, $350 for the procedure, and $350 for the pathology fee. So 3 months-ish and $1,200, $1,400 later, they get the mole biopsied or the skin tag removed. In our office, you come see us with the mole, we biopsy that in about 5 minutes and send it to pathology, and the pathology fee is $75. So we saved you or your employee 3 months of time and about $1,000.
Dr. Paul Thomas is a Detroit physician and entrepreneur who founded Plum Health, Michigan's first direct primary care practice. It's quite an achievement. He's a champion for affordable, relationship-based medicine in underserved communities. He's a leader in showing how innovation can humanize healthcare delivery. So we're honored to be here today. Really appreciate you having us here at your facility. We're going to get a few pictures around the place before we leave. But
Plum Health headquarters.
That's right.
Global headquarters.
Global headquarters. That's right. So I guess the first question, I just want to start in with what made you do this? What made you question the traditional healthcare system? And was there like a defining moment that pushed you toward doing this?
Yes, absolutely. The defining moment is that I believe that healthcare should be affordable and accessible and excellent for everyone. And that's a radical belief because it just isn't. Healthcare isn't affordable, accessible, and excellent for everyone. And there are great disparities between Detroit and the suburbs, and between health professional shortage areas or underserved communities and those with good medical care or available family doctors. And as a family physician, I saw that doctors had less and less time with their patients, and I wanted to work in a model where I could have more time and spend enough time with my patients. And that's where direct primary care comes in.
So what would you say the problem is that you're solving for these patients? Is it access? It goes beyond access?
Yeah, systems-based thinking shows that in the insurance-based family medicine system, family medicine doctors have 2,400 patients on average. And in the 1980s, family doctors had 800 patients on average. Now there's 2,400. So family doctors see 1% of their panel a day, or about 24 patients per day. They must spend, or they only get to spend about 20 minutes per patient if they see 24 visits in a day. And on top of that, the medical documentation, the electronic medical record, takes about 2/3 of the doctor's time in that 20-minute visit. So you get 8 minutes of face-to-face time, and the doctor spends 12 minutes typing, either in front of you typing with their back turned to you, or they take it home with them at night. And so I thought that model was broken, and I wanted to practice in a model where I could spend 30 minutes to an hour with my patient, or enough time with them, or as much time as they needed, and still have time for urgent care visits. And I could be comprehensive in recommending preventive care, like ordering mammograms or PSA tests or getting colonoscopies for folks. And I found that that wasn't possible in the insurance-based system, so I went into this direct primary care world.
Were you part of a traditional practice before this?
Yes and no. I did my residency training in the traditional model. I trained at Oakwood, which became Beaumont, which is now Corwell. And the training was, look, you're going to start with 4 patients in a half day or 8 patients in a day. And in your second year, you're going to see 6 or 7 patients in a half day, or 12 to 14 in a day. And in your third year of training, your last year of training, you're going to see 8 to 10 patients in a half day. And then when you graduate, you'll see 12 patients in a half day or 24 patients in a day. And if you stay with us, we'll give you a $160,000 base salary and a $10,000 signing bonus. Right? That was the calculus, and I said, no, thank you. I'm going to start my own direct primary care practice. And I did that in November after starting my direct primary care practice. And halfway through my residency, I started working in urgent care. And for the first year of my DPC practice, I worked in urgent care. I would see about 50 patients in a 12-hour shift, or about 3.5 patients an hour. And then on Saturdays, I worked for 8 hours, and I would see 30 to 35 patients in those 8 hours. So again, 3.5 patients an hour. That's a model in urgent care work.
Yeah.
You have to see your patients in 15 minutes or less.
Yeah. So how did you come upon this direct primary care model? Where did that come from?
Yeah, so I saw a speaker at the Michigan Academy of Family Physicians in Traverse City, Dr. Flanagan. And then I also heard a podcast of Dr. Josh Umbear. Dr. Flanagan worked in Colorado, and Dr. Umbear still works in Kansas, Wichita, Kansas.
Mm-hmm.
And so in my third year of residency, I wrote a curriculum, direct primary care rotation. I offered that to my program director, and she approved me to drive out to those locations. So I drove out to Denver, spent a few days with Dr. Flanagan, drove out to Wichita, spent 3 or 4 days with Dr. Umbear, and I took the best of their practices back to this Detroit office, where I started my own Plum Health.
Mm-hmm. So, again, you were serving, I'm sorry, go ahead.
Yeah, and at that time, there were only 350 doctors across the country doing DPC. So it wasn't like I could just see somebody locally who was doing it. I had to go elsewhere. Mm-hmm. And those were two of the pioneers in the movement. And so I really learned from the best, so to speak.
Does the patient population that you see now differ from what a traditional doctor would see? And if so, how?
Yes, absolutely. So most doctors are rational, and they set up their practices or work for corporate systems that set up their practices in the wealthiest communities with the best payer mix.
Yeah.
So meaning you have the Blue Cross Blue Shield Platinum or Silver plans. And there are very few doctors in Detroit. There's only about 50 to 100 primary care doctors in Detroit for 670,000 residents. So one primary care doctor for every 6,000 residents. And in Oakland County, there's one primary care doctor for every 600 residents. And so we see patients who are enrolled in Medicaid, uninsured, underinsured, and fully insured. We truly see the full spectrum of people here in Detroit.
So I guess that begs the question, two things. One is that, I'll ask the general question later. I'll ask a specific question now since you opened that up. So that suggests to me as an entrepreneur, and to you as an entrepreneur, I'm sure, how are we going to make this work financially?
The beauty of it is it's $1,000 a year. It's $85 a month.
Yeah.
It's a cash-based model. If you can afford a cell phone bill, you can afford direct primary care. If you can afford a Comcast bill for your family, you can afford a family plan via Plum Health, right?
Yeah.
And so that's the radical idea, is that even though you're enrolled in Medicaid or making less than $34,000 as a family, you could still afford reasonably a Plum Health membership. I say anybody with an income can afford a direct primary care membership.
So that makes it work for the patient. How does it work for you as a provider?
The math is that if we have 500 patients at $1,000 a year, we have enough money for our overhead and to pay our doctors really well. Or compensate them at the Michigan average, which is about, most doctors in Michigan make somewhere between $180,000 and $240,000 a year. And so we're able to match that or exceed it in some cases.
So, this was a new thing that you were bringing to Michigan when you brought it. And, it's tough to start anything. And it's even tougher to start things here. What gave you the confidence that, you could make this work here?
Sure. So when I graduated from residency, I had no business training. So I went through the Build Institute, and they do an 8-week entrepreneurship course. And then I did the Tech Town Retail Boot Camp. And their goal is to get you from idea to open, specifically a brick and mortar space. And I also wrote a grant through the Motor City Match, and I got at first a $3,000 award, and then I got a $50,000 award.
For the space.
Exactly. Yeah. And so those programs gave me the confidence to open my own business. And it also gave me the business relationships through the speakers, through the cohort that I was with, and through other people that we met to go ahead and start this business model or start this business. And also, I had my first customers. I set up a website, and it had an enrollment portal where you could enroll in the service. And about 9 people had enrolled, and somebody called me and said, "Is this a real thing? Because I enrolled. I haven't paid any money yet, but
Yeah.
if it is, I just took my last antidepressant." So I made the house call to them and started my practice November 9th, 2016. So we're just about 9 years into this
Wow.
crazy direct primary care journey.
Yeah. So, again, just taking it back to how entrepreneurs get started on things. I remember when I started my business, people thought I was crazy. You're going to leave this secure thing and start a business in your house. And it's a family thing, it's a friends thing. Did you have any of that to contend with?
Yeah, of course. My dad grew up, my grandfather was a tool and die guy in Chrysler, worked 35 years and retired, right?
Yeah.
And always had, health insurance through his employer. And then my dad similarly worked on the assembly line to pay for his accounting degree and went to Walsh College. And I told him what I was doing, and he's like, "You're not going to bill insurance at all?" And he thought this idea was completely crazy. But he's a great dad, and he still encouraged me to follow my dreams. But it just kind of set him back. It's like, I don't really understand. He understands now. He's a part of the service. He sees Dr. Orlick and loves the relationship that he gets and the time that he gets with her. But initially, people didn't really understand, okay, this is not insurance-based. And as you know, Detroit's a very blue-collar town, and a lot of people, especially unionized folks, are really married to that Blue Cross Blue Shield pays for everything.
Yeah.
And people remember, I remember when I didn't have a copay, or my copay was 25 cents, or my copay was $1. Times have really changed though. Yeah. And now that those benefits are eroding over time, people see the real positives of a model like this.
Mm-hmm. So as a business, you have that $1,000 per patient per year revenue stream. Are there any other significant revenue streams for the business?
No, that's it. We make the money on the memberships, and we work with corporate groups, which is really important, and school districts. So this year we're partnering with the Townsend Hotel, TechSmith in East Lansing, Quality Dairy in Lansing, and we work with public schools, including Lansing, Corunna, and Van Buren, along with some other associated public schools. And they buy this membership for their employees, and they're self-funded. So being self-funded, they control all their costs. So if an employee goes to the urgent care, they get a $350 bill. If their employee goes to the emergency department, they get a $2,000 bill. When they partner with us at Plum Health, we reduce urgent care visits by 75%, and we reduce emergency departments by 40%.
Wow.
So for a group in Michigan with 700 employees, we delivered $1.2 million in savings in 2024.
Yeah.
A $1,700 per employee return on investment, right? 2.1x ROI. So it pays for itself, and then some.
Yeah, so they're crazy not to do it.
Exactly, but then it's like you got to find the right HR director, the right CFO, the right CEO who really believes in this. And sometimes they're just like, this sounds too good to be true. What's the catch? There is no catch. The catch is that your employees get a concierge level service at $85 a month. And some groups will pay for the meds and labs, and other groups will have the employee shoulder the cost of the meds and labs, which we deliver a 90% savings on those meds and labs. So they're pennies on the dollar.
Yeah. So you are taking care of the primary care need.
Yes.
What happens when these people need acute care or when they go into the hospital? How does that work?
Right. So for those employer groups, they have insurance.
Yeah.
Right. And the beauty of it, they have a PPO plan on the back end. So they can go to a specialist. They can go to the urgent care if they need to. In the 25% of cases where we can't help, it might be 9 o'clock at night on a Saturday. Or they go to the ER, right? And it's covered by their insurance.
Yeah.
Our goal is to reduce all the unnecessary ER and urgent care visits and the unnecessary specialist referrals. Let me give an example. A lot of people are walking around with a skin tag or a mole. They would see their primary care doctor who has 8 minutes to take care of them, and that primary care doctor will say, please go see dermatology. They wait 2 months, spend $350 for the visit, $350 for the procedure, and $350 for the pathology fee. So 3 months-ish and $1,200, $1,400 later, they get the mole biopsied or the skin tag removed. In our office, you come see us with the mole, we biopsy that in about 5 minutes and send it to pathology, and the pathology fee is $75. So we saved you or your employee 3 months of time and about $1,000.
Yeah. So you take care of a lot of those things that they would have gone to
Yes.
a specialist
And
for.
there's a sinister take, or the conspiratorial take. The managers at health care systems, the large healthcare systems, you know their names around town.
Yeah.
They tell their primary care doctors, don't do the biopsies, don't remove earwax, don't do the knee joint injections, the shoulder joint injections, don't do the toenail removals. Refer all those to dermatology, orthopedics, podiatry, because they can bill at a higher rate than you can. If you do the biopsy, you can only bill for $50. But if the dermatologist does the biopsy, they can bill for $350.
Wow.
So for the large health systems, they buy the primary care offices because they become a referral source and a revenue source. And every primary care physician that's employed by a large hospital system is worth $1.2 million in downstream revenue.
Wow.
So for us, we want to save the company's money, and we do that by reducing those unnecessary referrals. Of course, if you have a complicated case of diabetes that's not controlled with 1, 2, or 3 medications, we will refer you to endocrinology. But for most people, you don't need to see a psychiatry because you have depression, and here's the medication or medications that can help. And we'll save you a 9-month wait to see psychiatry.
Yeah. Wow. So, thinking about what's happening in healthcare right now, and with the ACA situation,
Of course.
Even before what's happened now, you've got people who have to go out there and find their plan, right? And
Of course.
go through this maze. So it sounds like direct primary care is an option for those kinds of people because it can reduce the cost of the kind of plan that they would buy.
Of course, yeah. If you're on a silver plan, consider a bronze plan. If you're on a gold plan, consider a silver plan or a bronze plan, right? Or if you want to go all in, you can buy a health share or like a shared health savings group. There's groups like Sedera and Curo and others where you pool your money and you have an unshared amount, but they pay any additional claims. So there's some interesting things you can do. But we take care of 90% of your healthcare concerns, and we encourage you to buy an insurance plan or a health share plan so that your back end is covered should you have a heart attack, stroke, or get in a car accident.
And those people who can't afford to buy those plans are ostensibly Medicaid type patients.
Yeah,
and whatnot.
Medicaid, or maybe you make $30,000 or $40,000 on paper as a truck driver or hairdresser or bartender. And you don't have the excess funds to go out and buy an exchange plan.
Do you have any Medicare patients in your
Of course.
practice?
Yeah. We take care of all ages. Medicare is typically for those who are 65 years of age and older.
Yeah.
And a lot of folks know that they have a Medicare plan or a Medicare Advantage plan, but it doesn't guarantee them an hour with their doctor.
Yeah.
And if they have a complicated health issue, or if they just like to have an on-time appointment with somebody who cares about them, they can come see us.
Okay. So yeah, we've seen so much turmoil and so rapidly increasing costs in this healthcare market. What major disruption, do you see coming, or would you like to see in the market at this point?
Yeah, I think health insurance plans should be smarter and create catastrophic coverage plans. And the issue with the ACA, well-intentioned and good for the most part, codified health insurance as the only way to access health care.
Yeah.
And it has delivered record profits for health insurers like United and Blue Cross Blue Shield and Aetna and
They got
Cigna.
a bunch more patients.
Yeah, and United's profit is something insane. I think it's in the hundreds of millions of dollars a day. I think it's something like $250 million a day or something insane like that. That's just their profit. You'll have to check my numbers there, but it's quite high. And the other issue is that everything has to be covered under those health insurance plans. They're considering putting more into those plans, like doulas and flu shots, right? You should buy a flu shot for $17 every year or $25, and that free market aspect's going to lower the cost of that flu shot. And if you want a doula, you should pay the $1,000 that it would cost for a doula.
Yeah.
And it shouldn't be a part of a health insurance plan, because that means we all pay for it, and then it comes in at an inflated price because none of us are aware of the actual cost.
Yeah.
Right? So those would be the simple things. Or, I don't know, make the cash prices more readily available. Mm-hmm. Why am I being charged $30 for a blood pressure medication that costs 1 cent or 2 cents or 3 cents a pill?
Yeah.
Right? Or why is the plan being charged?
Yeah.
Why is the employer being charged $30 for a blood pressure medication that costs 1 cent per pill?
Yeah. The customer doesn't see it, so they don't.
Yes,
they don't
exactly.
care. Yeah. So in what you're doing, and again, what I hear around town, generally really positive reviews of your practice. But this community relationship seem to be central to what you're doing. So what have you learned and what have you done to build that credibility with patients and partners?
Sure. I mean, go where the people are. You know me, like you held an Urban Entrepreneurship Institute event, and I was there and just loved talking with
your
folks.
son.
With my son, yeah. I drop off and pick up my son from school every day, or Tuesday, Thursday, Friday. And so any evening events, I try to go, and I'll bring him once in a while. And I've visited block clubs. I'm a part of the Corktown Business Association. I got invited to speak at an elementary school to 5th graders about careers in medicine. I get invited to speak at the Wayne State School of Medicine 2 or 3 times a year to their medical students. I do a Welcome to Detroit lecture. I talk about careers in family medicine. I talk about business in medicine. Anywhere I'm invited, I like to show up. I love being invited. I like to go. I like to talk with people. And I really try to listen. What are the challenges that you're facing in accessing care? And really try to understand what people need. And we really try to deliver on those needs.
Okay. Yeah, so I've seen that you've seen significant growth, and scaling a practice like this, I know it can be difficult. We always like to think about what technology enables in these entrepreneurial, what kind of systems or tools have helped you to be able to scale your business?
Yeah, I mean, the simple stuff like building a website on Squarespace where you can edit it in real time and update it with a blog and improve your search engine optimization, and then asking people for 5-star reviews on Google once they have a great experience. Sometimes I'll text people, hey, I hope everything well for you. I always want to answer your questions, and they'll text, this is the best visit I've ever had. And I'll respond, leave us a review on Google. It goes a long way, right? And then to other more nuanced stuff like having an electronic EMR where you can email all of your patients, having a HIPAA secure platform where people can message you in the app, Facebook, Instagram, LinkedIn. As you know, I do really well on those platforms with content, and that drives engagement and helps spread the awareness about what we do, and then it gets people to click and find out more. So many different tools that have allowed me to grow my business. I feel really fortunate to be in this age of social media to be able to grow my business in this way.
Always it looks good, when you made it. Or I'm sure you don't think you've made it, but you're doing well.
Ways to go,
your practices recognize that things are running relatively smoothly. But I know things weren't always that way, right? With any business, what kind of early challenges did you face, and how did you address those? And what did it teach you?
Yeah, so I read a lot of business books. One of my favorites was Gary Vaynerchuk's Crush It. When I didn't have a lot of patience, I had a lot of free time. So I listened to audiobooks, read business books. Grant Cardone, some of his stuff, is good for like sales.
Yeah.
And one of the things that Grant Cardone says, the person aside, he's a good business mind. He says, your biggest challenge is being anonymous. Nobody knows who you are. And so I really leaned into social media to grow my business. And Gary Vaynerchuk, similarly in Crush It, talks about really leaning into these platforms to tell your story. And one of the things that really stuck with me that Gary Vaynerchuk had said is, document, don't create. I don't really create content. I don't really do really polished and buzzy videos. I just take a photo of a wart that I treated or a biopsy that I performed and show the before and after, or the laceration I repaired, or the Lego that I removed from a child's ear.
Oh my goodness.
And I post those photos with permission, and those get the best traction. Or I just post a photo of me at an event like yours, or at a pitch competition for Detroit Demo Day. We won $50,000 doing that. Or when the mayor came through and cut the ribbon with us. Photos like that, just documenting what we do every day, the good care that we provide, the great doctors that we get to work with, the patients who share our story. Those are all the things that have helped us grow.
That pimple popper promotion is it's always
Dr. Pimple Popper, right? That's great.
Always gets people's attention.
Yes.
So were there times or moments when you doubted whether this direct primary care thing was going to work?
Yeah, never a doubt. I just believe that this is where the market's growing. 100% of doctors aren't going to do this, and that's okay. And 100% of patients aren't going to do this. But I tell other doctors when I mentor them, you need 400 people to have a really successful practice. And that's really all it takes if you're a solo doctor. And for us, we have 4,000 plus patients right now. We're getting close to 5,000 patients here in 2026. And we have a tremendously successful practice. But that is, the population of Michigan is 10 million people. That is, help me with the math here, 0.04% of the Michigan population, or 0.004%. It's a very low percentage. It's a small percentage. I just imagine, what if we had 1% of all of Michigan? That would be 100,000 people. That would be a $100 million business.
Wow.
Right?
Yeah.
Am I doing that right? 100,000 people?
I don't know. I'm a fuzz.
Something like that. But it doesn't take that many people to be successful. I would say we're very successful with 4,000 patients, and I feel blessed. But there was never a doubt that I would get to 400 patients. And then when I did, I got up to about 575 patients. And then Dr. Orlick asked if she could join the practice. And she's been with us for 6.25 years, right? 6 years, 3 months. And she's been a tremendous asset to the community. A female doctor, taking care of many of the women in the community who wanted this. They were kind of sitting on the sidelines, like, I like the idea, but I'd rather have a female doctor. And that's great. So I hired Dr. Orlick, and then we hired a Spanish-speaking doctor to take care of some of the Spanish-speaking folks in the community in Southwest Detroit, and we've grown from there.
Okay. Well, for years, you would never use the term doctor and entrepreneur in the same sentence.
Of course.
It's kind of a recent thing. How has being both affected your view of leadership and service?
I love being a doctor. I love the Hippocratic Oath. I got it right behind me. Primum non nocere, first do no harm. Right? And I also love being a business person, because I firmly believe that our healthcare systems would be better if they were all run by physicians. The highest performing hospitals have physicians as CEOs, right? So we need more doctors to take the mantle of business and medicine. And I hope to inspire other doctors and show them a path to entrepreneurship in medicine, business in medicine, being a leader. And I feel really fortunate to occupy that role.
Okay. Well, so we've been through most of the topics I wanted to discuss with you, but now we have like a lightning round.
Of course, right? I'm ready.
A few quick questions. So, one book or resource that influenced how you practice medicine?
A lot of them. I mentioned a couple before. I just read Brene Brown's Dare to Lead, and I read another book called Radical Candor. As I grow into this CEO, medical director role, chief medical officer role, it's hard to manage people, right? So managing people is probably one of the most difficult things I do now as a leader in this organization. So having conversations with Radical Candor is critical to our success, and gaining some of the knowledge from authors like Brene Brown and Dare to Lead has been transformational in the way I think about my business.
Okay. One misconception about healthcare entrepreneurship?
It's It's not as hard as it looks, right? Take great care of your patients. Get a QuickBooks account so you can take recurring revenue. Have a business model where you get recurring revenue.
Yeah.
And focus on care and service and communication, and you can succeed.
Okay. One community partnership that exceeded your expectations.
The Corktown Business Association. I love being a part of the Corktown Business Association. I got to meet the leaders or the owners of several businesses around town. One notable person is Mike Ransom with EMA. Go to EMA Noodles, EMA Izakaya.
Yeah.
Great restaurant,
Yeah.
amazing founder, amazing entrepreneur. He signed up for the practice and then signed up several of his employees, and now we take care of about 45 different employees at EMA.
Yeah.
And similarly with Alpino and Atava Via and several others in Corktown.
Okay. One change, and we touched on this before, one change that you'd like to see in the U.S. healthcare system.
I'd love to see more catastrophic plans that are truly affordable for folks, where they could pair direct primary care with a catastrophic plan. Or I would love to see Blue Cross Blue Shield or Priority Health build direct primary care into their insurance plan offering, where if you buy a Blue Cross Blue Shield direct primary care plan, you have automatic access to one direct primary care doctor in the state of Michigan. And they've done that with plans in Maine and Kansas and other states across the union. So I'm hopeful that this change could happen. It's probably not going to be with Blue Cross Blue Shield. Maybe it'll be with Priority Health or somebody like that. But that is on the horizon. It's a very real possibility.
So what is the trend, the market trend for this direct primary care? Is it
Yeah,
positive?
so currently 3% of family physicians practice in the direct primary care model. I truly believe that we'll get to an 80-20 rule, where 80% of people are going to be satisfied with the insurance-based level of care that they get. 8-minute visits, 20-minute visits, use the urgent care when I need it, go to the hospital when I need it. But 20% of people and 20% of doctors want this kind of direct primary care relationship.
Okay. So wrapping up, a couple of actionable takeaways for our entrepreneurs out there. So for entrepreneurs who are exploring healthcare innovation, what's the first concrete step you recommend them taking before launching? Pilot, partnership, or proof of concept?
Yeah, find a community need and work at solving that need. If there isn't a problem in the market that you're solving, it's not worth writing a business plan over, building an app over. Find a real community problem that you're trying to solve. For us, it's access to healthcare at an affordable cost. Affordable, accessible, excellent primary care. And that's an abundant problem in Detroit, in Michigan, and across the country.
We're finding it, and we're going through a thing right now where we're asking people to submit their problems, submit a problem statement, right? Take 60 seconds and just say, it's incredibly difficult, even for entrepreneurs, to step back and say, what problem am I solving and who am I solving it for? So we're trying to inculcate that more in the culture, you know. So what mindset or principle keeps you grounded while you're balancing your purpose and sustainability in your work?
What keeps me grounded? I mean, it's just the focus on taking care of our patients and doing it in a timely manner and giving them excellent care and service. That keeps me grounded. Every patient is critically important to us, and every patient experience, from how our staff answers the phone, our doctors answer the phone, our medical assistants answer the phone, making sure that they're getting the right medication at the right time, making sure their imaging studies are easy for them to obtain at an affordable cost through our imaging partners, making sure we deliver the lab results in a timely manner. We usually draw blood one day and get the results the next day, making sure that we're communicating those results with them seamlessly. All of those things are critical to our success. So my focus is on patient care and helping our teammates deliver the excellent patient care that I expect. I set a really high standard, and I want to help my teammates attain that high level of care.
Well, I appreciate the time you've taken today. You know, I really liked and admired what you were doing before. I like and admire it even more now.
Well, thank you for that. Thank you, David.
Thank you so much.